I work at a nursing home as a nurse aide, and am one of a few that work 6A 6P instead of 7A 7P. This means I come in while night shift is still working. Since I worked night shift before, I had several friends on that shift. On this particular day, I woke up with a pounding migraine. Usually if that happens, a nurse will give me OTC medicine like Tylenol or ibuprofen. So I go and ask a nurse friend for something. She's a lot older and is a little sketchy, but we always got along. So she digs around in her med cart and tells me to close my eyes and open my mouth. I'm a little confused, but I do it. She pops a pill in my mouth and hands me some water to drink it down. I asked what it was and she said, "Don't worry about it." Okay? So I go on about my duties. Maybe 30 minutes later, I'm in the middle of helping serve breakfast and start feeling dizzy and like I'm gonna pass out. I take off to the bathroom and sit down on the floor. I start feeling hot, and I'm just trying like hell not to go unconscious. Other coworkers are checking on me and brought me a wet rag since I was sweating profusely. I finally feel good enough to leave the bathroom. My boss tells me they have someone to cover for me and sends me home. The thing is, I have had reactions like that before on narcotics, like Lortab and Percocet from previous surgeries/injuries. I know that nurse gave something like that to me, which also means she stole it from a patient because those only come as prescriptions. TLDR, nurse coworker drugged me with a narcotic when I asked for OTC pain meds for a migraine, and I had a horrible reaction and had to leave work. Edit to add, the only thing about this story that is not true is that it happened several years ago when I was maybe 21, 20 seconds, so not today IFU, more like years ago IFU.